Well, the Ministry of Health is doing a review of puberty blockers. Puberty blockers are used as part of the process to help young people who are gender confused to start the process of trying to change their sex. They're used to delay the changes of puberty, and when taken regularly, they stop the body from making sex hormones. So that includes testosterone for boys and estrogen for girls. So for boys, they slow the growth of facial and body hair, prevent voice deepening, and limit the growth of the penis, scrotum and testicles. For girls, the treatment limits or stops breast development and stops menstruation. Sounds problematic, doesn't it? Whenever you interfere with the natural process, and especially puberty, there's always going to be issues. The Ministry of Health is reviewing the use of puberty blockers here in New Zealand. And you won't believe who they've asked to review the evidence. Let's check it out. So New Zealand has been prescribing puberty blockers at a rate 10 times higher per head of population than the UK, where puberty blockers have just been stopped because of what's known as the 4-year-long CAS review, which concluded that puberty blockers should no longer be prescribed to children except in the context of research due to the powerful drug's effects on brain development and bone health. It also said cross-sex hormones, estrogen and testosterone should be prescribed to trans-identifying 16 and 17-year-olds only with an extremely cautious approach, and there should be a clear clinical rationale for not waiting until the teen is 18. Now, the CAS report also destroyed the suicide trope. The statement, better a live son than a dead daughter. It's a statement used to manipulate parents who are scared about what to do. And what the CAS review said was young people facing gender-related distress had no significantly different levels of suicide risk to other young people with similar levels of complex presentations. And there's no evidence that gender-affirming treatment reduces the suicide risk. So the Ministry of Health here in New Zealand is reviewing the evidence, and as part of the process, they'll be updating the guidelines. Now, Te Whatu Ora, Health NZ, which is what replaced all the 20 DHBs, and the operational part of the Ministry of Health, have contracted a group to write up these new guidelines, which are due in August. And they've contracted none other than PATHA to write the guidelines. PATHA, Professional Association of Transgender Health Aotearoa, is a group of trans activists. They supported so-called conversion therapy bans, but they want to practice conversion therapy on children. Ironic, isn't it? Virtually all their leadership team and advisory board are transgender and are closely affiliated with the massively discredited WPATH, the World Body. But who's reviewing the evidence from the Ministry of Health? Well, Speak Up for Women did an OIA, Official Information Act, request to the Ministry of Health to find out. And here's the response. The evidence brief examining the safety and long-term impacts of puberty blockers will be released shortly on the Ministry of Health's website, along with our position statement. And then down to the bottom, the evidence brief was peer-reviewed by Professor Paul Hoffman of the Liggins Institute, University of Auckland, and Dame Sue Bagshaw from Christchurch. Now, I hadn't heard of Professor Paul Hoffman before this, but a quick bit of research confirmed some concerns. He helped set up the guidelines 15 years ago, and in 2013, in this article, Hoffman said he was a cautious supporter of intervention through puberty blockers once a youth had been diagnosed by one or more psychiatrists and counselling support. Quote, he said, "This is a vulnerable group of children and adolescents. It's a psychiatric condition, not medical." End quote. Okay, well, if it's psychiatric, why would you use puberty blockers? I mean, that's like using weight loss pills for anorexia. Now, after the CAS report came out in early April, Professor Hoffman was on News Talk ZB, and he argued that the puberty blockers could reduce suicide and suicidal ideation in some parents. He admitted there hasn't been strong follow-up studies. or issues around safety, but a major red flag. He says puberty blockers are all reversible and that safety is a bit of a beat up. And look, I'm going to just play this interview clip. And by the way, they mention precocious puberty. It's a completely different issue relating to when puberty begins too early for the child who's going through it. Puberty blockers, on the other hand, blocks the natural process at the right time. Have a listen to this interview with Professor Paul Hoffman.
Of 50 studies, only one was of high quality, the others criticised for various flaws. Explain to me as a layman, how is it possible the medical profession goes down a path with no evidence?
Well, it's unfortunately not just this situation. It happens in many situations where people feel that the information that's present justifies a treatment. I think there's two components to this treatment, or two main components from a medical perspective. One is blocking puberty until the children are of an age to make their own decisions, which is around 16 generally in New Zealand, or Gaelic competence. And then there's the use of, and that's all reversible.
And that's controversial, isn't it? I mean, 16, as Cass points out, 18, brain's still developing in your 20s.
Yeah, that's true. But if you look at a whole range of situations, so we use puberty blockers in many thousands of children for precocious puberty, and that's something I have been involved in. There is no evidence that there's any issues there in both physical and mental health, although, again, the data is not super great, but the data out there would suggest there's no difference. There's also situations where people go into puberty after 16, 17, and they have no long-term problems either. Right. So I think the data around safety is a bit of a beat-up myself. But I do think very clearly that there is an issue with efficacy, is what are we doing, and are we doing something that's effective? And I've had to say the other point to that is if you're treating with testosterone in a girl or estrogen in a boy after the age of 16, that certainly may have impact, permanent impact, and we know that. And so that becomes more of an issue to me rather than the blockers themselves.
I'm almost out of time, but in a hand...
Okay, well, look, let's give him the benefit of the doubt. He's expressing some concern, although using the suicide trope is a major concern. But here's the real issue. The other reviewer is Dame Sue Bagshaw, and that should make us all very cautious. Sue Bagshaw has been the go-to person for the media on this issue because she's one of the few medical professionals pushing the narrative they want. Let me show you what I mean. So starting in 2015, an article, A Transition with a Never-Ending Cost. And it says this: for trans youth, finding support is hard and getting funding for surgery is even harder. And then it talks about a person, I'm not going to name them, but it says that they were going for a walk so it's a biological girl, okay? But I'll read what the article says. When he decided to tell her he no longer... Oh, sorry, I missed a bit. That it says that the person was born with female parts, but began telling people he identified as a male when he was 16. He and his mum were going for a walk when he decided to tell her he no longer identified as a girl. I turned to her and said, "Mum, I feel like a boy." And she began telling him stories. The mum began telling him stories from when he was a child, how he would scream and cry when she put him in a dress. And the stories proved to them that he should have been born male. His mum wasn't surprised and said it all made sense. And then it talks about the fact that he had surgery. Let me just show you the photo. And this is actually in the article. And it says, the article goes on to say that the grandma paid $13,000 for her to have her breasts removed by a private surgeon. And you can see the effect there. Then began taking testosterone treatment 3 years ago, which comes in vials and is injected into the top of the hip every 3 weeks. And had her ovaries and uterus removed. And despite going through 2 invasive surgeries and so far paying over $13,000, the person is considering getting genital reassignment surgery in the future. And then there's a story about a 20-year-old, I'll just get rid of that image, you probably don't like that there. The story, it's very sad. A story about a 20-year-old person born with male parts, but takes estrogen pills and has had Botox and lip fillers in order to look more feminine, but she wishes to take her transition the whole way, including having genital reassignment surgery. Surgery can cost up to $30,000. And the boy, the biological boy, began her transition while he was still attending an all-male boarding school in Tauranga. He had to drive 4 hours to New Plymouth to see a hormone specialist, according to the article, and his high school's dean drove him to the appointments, and he advised him to freeze some of, and this is what the article says, I quote, her sperm, freeze some of her sperm, before he started taking estrogen. Yeah, I know it all gets confusing, but where's the parents, you ask? Did the school do it behind the parents' back? I mean, that's a good question. But anyway, then it's off to Dr. Bagshaw. Dr. Bagshaw says she believes the cost is one of the main things preventing trans youth from having surgery. She believes surgeries such as mastectomies and hysterectomies can make a huge difference to people's lives and should be cheaper. She explains that suicide, anxiety, social phobias and depression are amongst the effects of trans youth not getting the support they need. Some of them won't face people because they just can't face living a lie. Yeah, it's got nothing to do with the medical professionals and school deans not dealing with the presenting psychiatric issue. And she says there needs to be a one-stop clinic where people can come for their counselling, medical advice, hormone treatments and surgeries. Note there, counselling, medical advice, hormone treatments and surgeries. Oh, so the puberty blockers is just part of the process. As we knew, the Dutch protocol is what they call them, get them to the finish line. And just on a side note, in 2019, Sue Bagshaw was made a Dame Companion of the New Zealand Order of Merit in the Queen's Birthday Honours, sadly. In the article by Stuff celebrating the award, it said that after the arrival of their fourth child, she returned to work, initially at the University Health Centre and then Family Planning New Zealand. And it was in this role Bagshaw began working to improve access to reproductive health services, aka abortion, killing the unborn child, for young women by expanding the number of abortion clinics in the South Island. Yep, you can get a Queen's Birthday honour for killing the unborn and confusing the child. So 2021 comes along and the conversion therapy debate is happening, and once again, Sue Bagshaw is the go-to doctor for News Hub again to try and persuade anyone opposing transing children and giving them puberty blockers.
Youth health expert Dame Sue Bagshaw is confident puberty blockers are safe.
They are totally reversible, so that when you stop them, your own hormones grow up again.
She's supportive of transgender children using them to delay puberty, but she's worried the government's new conversion therapy law goes too far because of the risk parents could end up in jail for preventing their children taking the blockers.
I think that would be way too extreme. Criminalising things, I think, is not a good thing. I don't think that gets us anywhere.
The Ministry of Health maintains puberty blockers are safe and reversible. They can be given to children who display what's called gender dysphoria, where they feel they're in the wrong body.
It buys you time. And what these young people need is time as they work through what their identity is.
An identity Dame Sue is urging parents to be supportive of.
Yeah, well, in fairness, she didn't think that parents should be criminalised for opposing the transitioning of a child, but puberty blockers, safe as. Even the Ministry of Health says that. Of course, they're wrong, and they realised that and changed it, but not Sue Bagshaw. And then later that same year...
Whenever anything's social, it's also political. And that's what I put that down to, is very much some ideology conflicting with what we're trying to do to help these young people.
Dame Sue Bagshaw has treated scores of children with gender dysphoria, and while these drugs are the same ones used to chemically castrate male sex offenders in other countries, she's not concerned.
I don't have too much problem because they are reversible. And that's the main message I'd love you to get across, is that these drugs are reversible. I think a child of 12 or 13 definitely knows their mind. They might not have a mind that agrees with the adult mind, but they definitely have a mind.
Dame Sue Bagshaw says puberty blockers give children time and a safe place, even if, as she acknowledges, we don't yet know the long-term impact on brain development.
I'd rather keep them alive so they don't suicide and get into alcohol and other drugs than wait and go, oh dear, we're too late.
So you think that you're saving their lives then?
For some, yes, because they're so intense in their emotions. They feel like if they don't get acknowledged, life's over. It's not worth living.
British campaigners, however, used the opposite argument when fighting the Tavistock case, that there was evidence girls taking puberty blockers were more suicidal.
We've got unhappy kids, and instead of telling them it gets better, we're telling them, I see that you're unhappy, and the doctors are going to fix you. Doctors are going to change your sex, and we can't.
Yeah, and that was in relation to, there was a lot of concern around puberty blockers, mainly because of the Tavistock issue going on and the UK High Court decision. And Sue Bagshaw seems convinced that blockers are reversible. Interestingly enough, she had a student perform a literature review over the summer at that time, which found potential impacts on brain maturation. And in fact, Otago University removed claims by Dame Sue Bagshaw in regards to bone density recovery after puberty blockers from its website due to inaccuracies. But here she is, still saying these things.
This Christchurch doctor has been helping transgender youth pause puberty since 2004.
What the blockers do is give you space to explore that. And that's the important bit. And buying that time is really important because they're reversible.
The study collated research on puberty blockers from the last decade. It showed a really positive impact on mental health, but there's a lack of information on any long-term physical effects.
We need to help those who are in this situation so that their mental health can flourish and be who they are.
Yeah, and then a year later, in August 2022, there was this article, a GP shortage, rainbow communities struggle to find the right healthcare. And it said rainbow communities are struggling to find healthcare as a nationwide GP shortage continues. Canterbury has a peer group of up to 15 GPs skilled in gender diversity, a small number given the size of the transgender community both in Christchurch and nationally. Christchurch youth doctor Dame Sue Bagshaw is urging more training in the medical industry on the specific health needs of the LGBTQIA+ community. Bagshaw, a senior doctor at Christchurch's 298 Health, said there should be at least one person in every GP office with the skills, but that is not the case anywhere in the country. Yeah, well, she got her wish because Labour's budget in 2022 included an additional $2.2 million for gender-affirming care and $2.5 million to train GPs in advising trans youth. Apparently, they have health needs that nobody else has, apparently. And then the following month, there was this article, puberty blockers use jumps as expert backs result. And it says this, Dame Sue Bagshaw, who has many transgender patients at her Christchurch youth practice, conceded there were some unknowns about the long-term effects of puberty blockers, particularly on bone density. However, the same could be said of many drugs, and that was not a reason to stop prescribing them. Of course we should be cautious. We should be cautious about any medication. We should also be cautious about young people who suicide or attempt to. Can I remind you what the Cass review said and also the recent research out of Finland which backed this up? It said this, young people facing gender-related distress had no significantly different levels of suicide risk to other people with similar levels of complex presentations of mental health. No evidence that gender-affirming treatment reduces suicide risk. But continuing with the article, if you're going to say let's not use them, puberty blockers, we're going to have to redouble our efforts to ensure mental health of transgender diverse young people is looked after. And at the moment, it's not. Wow. Focus on mental health, healing the mind rather than cutting the body. What a great idea. Offering psychosocial support as first-line treatment for gender dysphoria in young people was challenging, she said. It's actually quite difficult to help them to understand that they're being listened to without doing something, and that's the nature of brain development, and it's also the nature of short appointment times. Gee, how does she deal with anorexia nervosa or suicidal ideation? You know, is it too challenging to offer mental health support? She goes on, psychological interventions are also expensive, she said. Dame Sue was not surprised or concerned that New Zealand's prescribing rates were higher than other countries. Yeah, 10 times higher than the UK. We're a small country. Word travels faster by word of mouth. Has she not heard of the internet or social media or TikTok? Says, obviously in the last 10 years it's gone up because we've now got societal permission to do that. No, you haven't, Sue. Your argument is crumbling in front of our eyes, thankfully. And then, just finally, even after the Cass review was released, she was the go-to for media.
The Health Ministry last year removed the claim from its website that puberty blockers are safe and reversible. Leading youth health specialist Dame Sue Bagshaw insists they are both. She says most patients on blockers do progress to cross-sex hormones.
Because most kids know what they want. Most kids know who they are, and that's confirmed with time. And so they do carry on with the hormones. It sets them on a pathway which they've already chosen by saying they have gender dysphoria.
Dame Sue says each patient must be treated as an individual.
It's almost become a moral panic that, oh dear, this gender issue, this is getting out of hand, we must do something. It's still only within 2%.
Ah, kids know what they want. It's almost a moral panic. And, it's only 2%. Kids know what they want. What child going through puberty knows what they want for their childhood, for their adulthood, sorry. You know, and Sue says, you know, it's a child's mind, not an adult's mind. Well, exactly, that's the point. They're not an adult or mature enough to be making such life-changing decisions. But this is who is reviewing the evidence brief for the Ministry of Health on puberty blockers. A cheerleader for puberty blockers. You still got confidence in the process? No, I haven't either. But given that this affects every young person who is struggling with their identity and may believe they're the opposite sex, we should have absolute confidence that children will be protected from a flawed and destructive ideology that's harmed so many young people already. And it's up to you and I to call it out. And just to leave you with this, we have a 19-year-old who has been through this and come out the other side, fortunately, Chloe Cole, and she is speaking at our conference in July. So I'll leave you with this little advert. You need to be at the Forum on the Family.
I went through the process of going through a social and medical gender transition between the ages of 12 to 16. I started medically transitioning at 13 with puberty blockers, testosterone, and at 15, I underwent a radical double mastectomy to remove my breasts. I stopped transitioning at 16 when I realized that I wanted to be a woman, that I was very feminine, and that I wanted to become a mother and have children of my own. And these treatments were potentially taking all of that away from me. And since then, at the age of 17, I've been speaking out about what happened to me. I've connected with many other people who have detransitioned as well. And I've testified in many legislatures across the United States, and even to Congress on my 19th birthday. And I'm looking forward to coming to New Zealand in July and seeing you all there.